In order to understand muscular dystrophy, we need to understand the muscular system. The muscular system is often divided into three types of muscle tissue: cardiac muscle, smooth muscle, and skeletal muscle. The first of these, cardiac muscle, or myocardium, is found in the heart, as the name suggests. Cardiac muscle allows the heart to contract and pump blood throughout the body. This type of muscle tissue contains contractile units called sarcomeres. The cardiac muscle is involuntary and beats rhythmically without the person asking it to. The next type of muscle is smooth muscle, which is another type of involuntary muscle. This muscle makes up the musculature in many organ systems and is the driving force behind the digestive tract. It also lines blood vessels and allows them to dilate and constrict to regulate body temperature. It's called smooth muscle because under microscopic inspection, there are no distinguished lines. Rather, it is a smooth collection of cells with centered nuclei. The third type of muscle, striated muscle or skeletal muscle, is found lining the skeletal system. This type of muscle allows for voluntary movement so that we can do things like run or work. These muscle cells also contain contractile units called sarcomeres, but this type of muscle is voluntary, which separates it from cardiac muscle.
Duchenne muscular dystrophy is one form of muscular dystrophy and is an inherited disorder. It involves muscle weakness, which quickly gets worse. DMD occurs because the mutated DMD gene fails to produce virtually any functional dystrophin. Some history of DMD. Until the 1980s, little was known about the cause of any forms of muscular dystrophy. In 1986, however, MDA-supported researchers identified a gene on the X chromosome that, when flawed, causes DMD. In 1987, the protein associated with the DMD gene was identified and named dystrophin. The dystrophin gene is the largest gene identified in humans and is located in the short arm of the X chromosome. Now let's talk about some of the causes and symptoms. DMD worsens quickly. It is caused by a defective gene for dystrophin, which is a protein in the muscles. The condition most often affects boys due to the way the disease is inherited. The sons of women who are carriers of the disease, which are women with a defective gene but no symptoms themselves, each have a 50% chance of having the disease. The daughters each have a 50% chance of being carriers. Very rarely, a female can be affected by the disease. DMD occurs in about 1 out of every 3,600 male infants. Because this is an inherited disorder, risks include a family history of the DMD. Symptoms may include fatigue, learning difficulties, intellectual disability. Muscle weakness begins in the legs and pelvis, but also occurs less severely in the arms, neck, and other areas of the body. Problems with motor skills, running, hopping, or jumping, skipping. Frequent falls, trouble getting up from lying down or climbing upstairs. Shortness of breath, fatigue and swelling of the feet due to the weakness of the heart muscle. Problem breathing due to weakening of the respiratory muscles. Gradual worsening of muscle weakness. And then as this goes on, progressive difficulty walking. Ability to walk may be lost by age 12, and the child will have to use a wheelchair. Breathing difficulties and heart disease often start by age 20.
Muscle weakness decreases the amount of movement, affecting one's ability to do simple everyday tasks. It usually affects the ankles and the hips and knees first. People usually end up in wheelchairs, making it harder to perform certain tasks such as working out or driving. They experience pain in different parts of the body which could interfere with tasks that they need to complete. For example, a common early symptom is hand cramps. This could make it difficult to write. DMD could lead to scoliosis as well, which is a curving of the spine. Heart problems could also be a result. heart problems are usually found in older boys. It is very rare, but intellectual difficulties could also be an outcome. A minority amount of people that have DMD have this. It is very common for patients that have DMD to have trouble breathing as well. For patients who have DMD, it could be difficult for patients to travel by plane, which is why families need to plan ahead to make appropriate accommodations. Early death is very likely for patients. Most patients only make it to about their early 20s.
Although there are no immediate cures for Duchenne muscular dystrophy, over time, the life expectancy rate has increased due to advances in respiratory, cardiac, and muscular care. People suffering from DMD need to be closely monitored throughout their entire life. Depending on how severe one's case is, they'll need neurologists, rehab specialists, physical therapists, lung specialists, cardiologists, orthopedic surgeons, and the list can go on. Treatment options can include taking corticosteroids, which help muscle strength and can delay the growth of DMD. There are 2 recent medications that target specific mutations, meaning they only work for some people. Also, there are heart medications that can help the cases where the heart is largely affected. Therapy options can include stretching multiple times a day because DMD restricts flexibility and mobility, causing limbs to grow inward and lock in place. Aerobic exercise, like walking and swimming, helps to maintain strength, mobility, and prevents cardiac issues. Using braces prevents the progression of contractures, which is the permanent tightening of tissue, and keeps the weak parts of the body stable but still moving. The use of canes, walkers, or wheelchairs can be crucial in giving enough mobility to the necessary extremities and joints. Breathing assistance can be very necessary because respiratory issues are a leading factor of death if not treated properly. Because DMD weakens respiratory muscles, something like a sleep apnea device helps regulate oxygen throughout the body during sleep. Ventilators can also be used in the more extreme cases. Surgery is usually on the lower side of consideration, only necessary and possible if needed to correct contractures or spinal curvatures that could affect breathing. Heart function can be improved with pacemakers. Preventing respiratory infections is important, so getting vaccinated for pneumonia or the flu would be crucial for somebody with DMD. In conclusion, DMD cannot be cured. Therefore, taking these steps can buy someone more time as these treatments and prevention options suppress the growth of DMD.